Okay. Good morning, friends. Joe here. I'm joined by my friend Josh this morning, and we are going to be talking about the Cowlitz County Department of Health. Josh, how you doing today?
I'm doing fantastic, Joe. Glad to spend another hour and a half with you on Sunday and excited for this conversation.
For sure. I know that this can get, uh, for some people, I know this can be pretty dry. But I hope that, we can talk through this in an engaging way. The goal of today is to really talk about the Department of Health and its function within the county government.
Yeah.
Um, there are a lot of um, facets to managing community health. Um, so let's start from the beginning. I think yeah.
Yeah, well, I think that makes sense. I mean, why don't you break it out for me, Joe? Because as always, I'm less knowledgeable about these types of things. So,
Sure.
starting from the beginning, like what does the Cowlitz County Department of Health do? What's their mission?
Yeah. So the Department of Health, they focus primarily on reducing the risk of like disease, but also more broadly, kind of promoting the health and well being of people within Cowlitz County. Their mission is to prevent disease, promote healthy lifestyles, and ensure a safe and healthy environment through partnerships, prevention, and education.
Yeah.
So, functionally, like the Department of Health has um, a role to play in the regulation, communication, and management of health and health programs in Cowlitz County.
Okay, awesome. And I have always been very aware of state health departments.
Mm-hmm.
So can you talk to us a little bit about how the county health department interacts with the state health department?
Yeah, well, so in Washington State, we of course have the State Department of Health,
Hmm.
and the local health department works with the state level agency to take the policies that the Department of Health more broadly has brought down and apply them in a local context. So. Their job is to actually follow through with the implementation of those policies in a lot of cases, and they also work to secure funding from both the State Department of Health and then from things like grants. Grants
Mm.
are like outside money you apply for. And then specifically for Cowlitz County, the Cowlitz County Department of Health focuses on managing public health issues. Just realistically, right? Like the state of Washington and their Department of Health is not going to be able to put as much focus onto individual communities, and so they have these kind of smaller versions of those agencies that are really just here to make sure that things work at a local level, right? There's a there's just a decided focus in this area, and you might think about them like an extension of the Department of Health, although they do operate kind of as their own entity, right? In the U.S., we have this structure that is generally like we have the federal level, we
Mhm.
have the state level, and then we have down to the local level. And so the Cowlitz County Department of Health is like the local level of the health agency, in the United States, anyways.
Yeah, awesome. So I would imagine that they do a lot of work with, local hospitals, local
Mm-hmm.
doctors, or I would hope they do. So can you talk to us a little bit about what that looks like in Cowlitz County today?
Yeah, they're not going to. So the Department of Health is not going to do as much of the implementation of that work, right? But they're going to do a lot in terms of communication and regulation. So what I mean by that is, first, the Department of Health is responsible for doing things like collecting data about the county. This has been one of their biggest roles in the wake of COVID, from 2020 on, was collecting information at a local level for the effects and impacts of COVID in Cowlitz County. Um, they are also responsible for communicating with those agencies, so with like the hospitals in our area, when there are adverse events. Maybe we have like an outbreak, and their job is to communicate that out to health providers. There's actually like an email you can go sign up for if you I believe you have to be a health provider in order to get this, but it's a direct line of communication between you and the Department of Health. And it's, I think, meant to be like a notification system for emergencies and things like that.
Yeah.
More broadly too, their interactions with the general public are going to be more informational. So, if you go to the website, they're going to provide information about, nutrition guidelines. They're going to give and they're going to collect information on behalf of broader agencies, like the State Department of Health. And so the goal is to maintain a relationship of collaboration. I think that's probably the neatest summary. Um,
Yeah. No, I mean it makes a lot of sense, right?
mhm.
It also, the way that you describe that directly correlates back to their mission of the promotion of health and the prevention of disease. So I think those two pillars that you walk through obviously align well to their mission.
Sure, yeah. Well, and for the general public, most of it is communicating about um, the let me see, like, I suppose the things that you need to know as a member of the public, right? So, we'll talk a little bit more in just a bit here about the community aspects, so the people side of it, and then the environmental aspects, right?
Yeah.
But the Department of Health is doing a lot of the communication of the things that you as a citizen should probably be aware of in your community. So, again, if you go to their website, you'll see pages about things like blue green algae,
Yeah.
and the impact of that on water quality and things like that.
Yeah.
So as an information hub, as a coordinator in case of crisis, they're part of the emergency management process, among other kind of more structural roles that the Department of Health fills. Um, that's kind of it.
Yeah. Awesome. Well, I think that was a really good introduction and a good segue to maybe take a quick break and then come back to the community health versus environmental health,
Sure.
right?
Yeah. Let's take a quick pause.
Awesome. Thanks, Joe.
Okay.
All right. Awesome. Well, as we were just saying, Joe, I know we kind of kicked it off and you were breaking it down into two pillars, community health and environmental health. So As always, help me wrap my head around it, and let's start high level.
Sure.
What's the difference between the two, and maybe you want to break them up into, like I said, those two different pillars.
Yeah,
So let's.
so we'll just differentiate these two, and then we'll go into kind of the individual functions. The line in these, in my opinion, is a little blurry. Now that might be different from the perspective of people within the Department of Health. Maybe there is a very hard cutoff between these, but the best way I can think to summarize community health and environmental health from everything that I've studied, from folks that I've talked to, is that community health focuses on the behavior. It focuses on preventing disease and ensuring access to healthcare services. So to me, that seems a lot like the individual people, the human side of health, right? Environmental health is more about safe and healthy living conditions. So, monitoring and regulating the aspects of our environment that contribute to our health and well-being. Things like food safety, water quality, things like that. So, in summary, community health is about the individual. It's about the people, their behaviors, and the impacts that those people have on their own health. And environmental health is about the conditions that lead to health and well-being.
Okay. Yeah, no, that makes a lot of sense, and I can definitely see how, from that high level view, you can see how they kind of cross lines and
Right.
intertwine, right? Like there's a lot of similarities between that. So why don't you start by breaking down community health, right? Like what are some of the main things that the Department of
Sure.
Health focuses on when it comes to community health?
Yeah, so there are 5 aspects that I think we'll spend a little bit of time on here. We might kind of move in between these, but at the core of it, we're looking at food safety, drinking water, school safety, nutrition guidance, and provider alerting. Some of those are, like I said, they might fall a little bit more into environmental health. They might fall a little bit more into the community side, but these are the ones that I think we would most of the time think about in terms of the role of the Department of Health in our daily life. So let's start with food safety.
Okay.
The Department of Health, among other things, does restaurant inspections. So their job is to go to establishments that offer food and make sure that they're maintaining proper food storage, that they're preparing things, they've got good handling practices. They also provide training materials for things like food handlers cards, right? Josh, have you ever worked in a job where you had to serve food and had to get a certification?
Oh yeah,
Yeah.
yeah. I'm actually a classically trained chef. As a side note, so I know very well about all of that.
Cool. So yeah, you have a sense of what we're talking about, but for most people, the basics of it are, you got to make sure that you're storing food at proper temperatures. What is it, below 41 degrees? Yeah. So things like that, right? I've never been a chef of any kind, but I did work at Wendy's for about 2.5 years, and have a general sense of what you're supposed to be doing. But they provide educational materials. What I just described there, food handler stuff, usually that's handled a little bit more by the state. I don't think Cowlitz County Department of Health has its own program for that, but they would obviously be a resource to connect you to the state in that case. And then when there is a foodborne illness outbreak, the Department of Health is responsible for managing the communication aspect of that, right? So if something fails, something goes wrong, their job is to kind of manage that. I don't know if we'd quite call it an emergency, but in their context, I think it certainly could be. Their job is to identify the point of outbreak and try to alert the public and alert local health providers when things go wrong. It's the kind of thing I feel like you don't want to have to do, but it's a very important aspect of managing food safety, that when things go wrong, you have somebody there to step in and deal with it.
Absolutely. Yeah, you need that oversight, and things do go wrong, right?
For sure.
We're all and there's a lot of human aspect in it, so that oversight is incredibly important.
Absolutely. Drinking water is next. So the Department of Health is, not directly managing the water systems, right? Depending on where you are in Cowlitz County, there would be either a local public works. So, for example, we have like the Longview Department of Public Works. Or if you're outside of city limits, you would work with the county. So Cowlitz County Department of Public Works manages the water system, right? But the Department of Health's job is to monitor those water systems for contaminants. So they're kind of looking at things downstream, and making sure that there are appropriate levels of like bacteria, chemicals, any heavy metals. Interestingly, I stumbled on at least one program that I think was sponsored by the Department of Health to talk about stormwater drainage. If you go to the Cowlitz County Department of Public Works, they have all these drawings that were done by students, basically saying, "Hey, don't drain into the storm drains. Don't like rinse your car off and pour it down a storm drain." The Department of Health, I think, has a big hand in that kind of communication. They're going to work with those public works departments to make sure that things are running smoothly. And, I think to some degree they're going to bounce off of each other, right? They also are responsible for working with those water system operators when things go wrong. Again, there to kind of help to address the issue, diagnosing the problem, maybe pinpointing where the exact issue is. But the reason that they're involved in that is because they're thinking about the aspects that actually affect people's health. So, if the issues with public works are not such that they would cause a problem for people, they'd probably leave it alone. Yeah, and then I think the last thing on water is there's also an aspect of permitting that takes place as well. So, if you're going to be building a new building, you're probably going to need to hook into the sewer lines, right? Yeah. And the Department of Health oversees the permissions that you need to get if you're a developer. This is also true if you want to, like dig on your own property, for example. Maybe you want to dig a well. The Department of Health is going to some degree, step in to make sure that you're not doing anything that would like contaminate the local water supply. They may also provide some help with like testing your groundwater to make sure that it's safe to consume, and other aspects like that. So if you are trying to do something related to water, you probably will interact with the Department of Health, at least at some point. Any questions there about water or food safety, Josh? Because I know we kind of breezed through this too.
No, I think it makes a lot of sense. And we have underground wells here too. So it was funny. You talked about the car washing. Same thing around here. And the big one is like not using, chemical fertilizer in your lawns and things like that for runoff. So does Cowlitz County historically, have you guys had issues with water? I know that's such a tough subject in other areas of the country. So I'm just curious about how that has been in Cowlitz County.
We have, yeah. This is actually something I think the locals are very aware of. So in our area, for example, we're up in kind of the northern part of Cowlitz County. We have problems with hard water, so we have a lot of mineral deposits in our water. Lower down in like the city of Longview, a lot of the infrastructure is just very old. If you remember from a time or two ago, we talked about the development of the city of Longview, and I was actually just talking with somebody earlier this week from the Longview Public Works, and she said, yeah, they might have built the water system to support 200,000 people. I think that was the numbers that I read, but she said, but they did it with the materials of the time, right? And as things change, we start to realize that some stuff is just not going to last as long as we hoped it would, and we have to do a lot of rip and replace activities to make things work. So water is a big part of the conversation here in terms of local infrastructure. One of the challenges, I think, is that the parts of the county that are most populous are also separated. So in that same conversation with the gal from Public Works, I had asked about the relationship between the county and the city, and she said, "Well, it's a pretty hard, firm cutoff. Basically, if you're outside city limits, you are not part of the Longview Public Works, and there's nothing that you can do to uh, get Longview involved in something that's out in the county." Um, yeah, so the management of that is really challenging, especially because there is such a hard cutoff between those. There is, I suppose, not as much collaboration as maybe you would expect. Of course, they are going to work together, but they're just doing different things, working on different systems.
Yeah.
So yeah, so I would say yes. Historically, we have had a problem with water. I think across the county that's true. Although the range of problems depends on where you're looking and where you live. Yeah.
Yeah. Okay, perfect. Thanks for that insight. No other questions on
Cool.
water safety.
Okay, and then school safety, right? So, this is the point where the Department of Health has an impact, probably on your life as a parent, right? Because they're responsible for communicating with schools about things that children should be aware of, right? One of the reasons I mentioned being a parent, by the way, is because one thing worth noting. I know, Josh, you're a relatively new parent, right?
Oh no, I'm not.
Oh no, you're not. Okay, I was mistaken. So as a parent, you are deeply affected by your kids, to the point where if your child is sick, you're home. Some if not most of the time, unless you can afford daycare or some kind of secondary support. And so the Department of Health and their role in the communication with children has a ripple effect on all of the people who are connected to those children. Managing a bunch of kids and keeping them from getting sick is really hard. My partner worked at a daycare for a while, and pretty much everybody on staff there said, "Yeah, you're pretty much sick all the time." Kids are kind of, I've heard them referred to as like walking petri dishes.
Totally.
And the Department of Health is responsible for providing that kind of communication. What are the risks? We talked before as well about the kind of outbreak management and things like that. If you have kids, that are all kind of in the same place every day, multiple weeks, there is the very real chance, very likely chance that somebody gets something and then it spreads very quickly to a large number of individuals out in the county. And so the Department of Health plays I think, a significant role in schools and school communication as it relates to those illnesses and diseases that are spreading around. They are also going to, in the case of an outbreak, work with those schools to try to identify the source, try to figure out, how many kids might have been affected, and then of course like communicating out to the public on anybody who might have been involved in all that. We've had some interesting cases in the last few years of measles outbreaks. I don't know if we've had one directly in Cowlitz County, but I know that we've had them in the Pacific Northwest relatively recently. And the Department of Health, to some degree, is also communicating the value of things like vaccination, for example, and the importance of that when you're trying to keep a large group of children who are otherwise vulnerable, whose immune systems aren't as developed, from catching something that they can't fight off. Vaccinations being a part of that, of course.
Yeah.
Any questions there?
No, I think that's pretty straightforward.
Cool.
Makes a lot of sense.
And then, the last two, we've already talked about, to some degree, the provider alerting, but nutrition guidance there is mostly just communicating what the, I think the term is the best available science suggests. Sure. So, the Department of Health is going to put out some kind of mandate or direction, and the local agency is responsible for communicating that out. Here you might think of things like the food pyramid and
Yeah,
stuff like
yeah.
that. Um, I think that those aspects are all impactful, but as we're kind of going through this, I would observe that a lot of these roles are going to be mostly in kind of the shadows, right?
Sure.
And I think that's true of environmental health as well. I think the impact of the Department of Health is not felt directly by most
Mhm.
people who are engaging with it. But it does obviously have a meaningful impact, especially in cases where we have to manage some kind of health crisis. So,
Of course.
any thoughts, observations, or questions on the community health aspect?
No, I mean it makes sense. I think when you break down those five subcategories, I can see the impact. I do get what you're saying around it is kind of behind the scenes,
Hmm.
and it's but it's really important work.
For sure.
Um, but yeah, no, I want to keep pressing on. Let's move on to environmental health. Talk to us about how the Department of Health gets involved there.
Sure. So there's a few different aspects of environment that I think are worth highlighting. One is meth lab flagging and cleanup, which is a really interesting topic on its
Yeah.
own. We have on site sewage systems, solid waste facilities, illegal solid waste disposal,
Hmm.
wells, and water quality grants. So let's dive into the first one there. So, how much do you know, or have you ever taken an interest, Josh, in the fallout of meth creation? I know
Yeah,
that's a big topic.
I have. I mean, I was in on the Breaking Bad craze, so but I'm also somebody who likes to dive deep into subjects. So I have also done some research. I mean, it is an environmental disaster,
Right.
especially when things go wrong too.
Yeah. What kind of stuff do you know about that that can go wrong in that kind of
Well, I
space?
mean, I just know that the processing and production of meth is very volatile, right?
Right.
So, um, combustion, so massive fires and fallouts on that. But we're also using heavy heavy chemicals to make this. So, and typically the folks that are making and producing meth are not very concerned about the proper disposal of
Hmm.
the heavy chemicals. So, I can imagine, especially in a county that relies on groundwater, like how that can play an impact on environmental health.
Yeah. So whenever we identify a former meth lab,
Hmm.
the Department of Health is responsible for like flagging that and assessing the level of contamination. They also have a hand to play in developing a plan for the cleanup efforts related to that, right? Like you pointed out, this is obviously going to be a huge environmental hazard,
Hmm.
um, if for nothing else because of the chemicals that are involved in the production of methamphetamines. And so they oversee the cleanup process and ensure that it's conducted in line with the established guidance. So they're just making sure that everybody's following the rules and that everybody's maintaining, safety standards. They also then identify and maintain records of those areas. Because if you're gonna purchase a house, right, you should probably be aware, hey, this used to be a meth lab, right? And so the Department of Health is an independent kind of space where that information resides, so
Yeah.
that nothing is like lost in the shuffle, so to speak,
Yeah.
right?
Yeah, that's
Uh,
important. It's probably not the main thing you're looking to advertise when trying to sell a house, right? So those independent agencies become important there. Um,
Yeah, there's, I think there's an adage of, or not an adage, but like a trope in fiction of like, oh, this house had somebody who died in it. But honestly, I think if your house used to be a meth lab, that's going to have way more impact on you than a poltergeist. Being funny,
Definitely.
but um, cool. And then let's talk about on-site sewer systems.
Yeah.
So on-site sewer systems, we're talking about things that are not connected to public water.
Big tanks.
So that's like septic tanks, right?
Yeah.
Drain fields, things like
Yep.
that.
Yep.
And the Department of Health makes sure that if you're going to be installing anything, we talked before about permitting. Um, they're going to assess the area to see, what kind of effect a septic tank installment might have. They're going to make sure that it meets the necessary guidelines, that it's safe, right? That it's not, well, in the case of existing on-site sewer systems, they might do some evaluation to make sure that it is not like leaking or anything like that.
Yeah.
And then they're also making sure that people have the right information on managing those on-site sewer systems, so that they meet those same standards. They do inspections. They maintain, records of maintenance and ensure that things are properly functioning. And they're also going to hold on to all of that documentation so that there is some kind of public record of these systems that are in place. I think an important aspect of managing the health of the environment, right? We talked about kind of the space where you reside, is that your neighbor is not doing something that would harm you inadvertently. And this is part of the reason why I think these kinds of regulations, while they might be frustrating at times for people who are just trying to get things done, why they do matter. I'm not an apologist necessarily for all of the bureaucracy involved in that process, but at the same time, I understand the value of making sure that your septic tank is installed properly so that you're not contaminating the water around you and causing harm, to other people in your area. Any questions or thoughts there, Josh?
No, I'm pretty familiar with that because we again, I grew up in an area that every place has septic tanks. So my parents being homeowners, we went through all that, the inspections, the checking, replacement of it even at one point because we failed an inspection and things like that. So, yeah,
gotcha. Yeah.
It wasn't fun. I mean, yeah, those things. Yeah, that was crazy. I mean, they because the leaching fields too. So I mean, it's a big aspect. But like you said, it's another thing that's just kind of behind the scenes what people don't think about, but has that disastrous downstream effects if not properly maintained. So.
Yeah, and the Department of Health to some degree as well. This might not be true at the county level, but it certainly is at the state level. They ensure that anybody who is working on these systems also has the right information, right? So they're going to do their best to communicate what those regulations are, what the best available science says the right thing is to do. Of course, nothing's going to work perfectly. Occasionally there are failures in that whole process, but ensuring that everybody has the same information and guidance, I think is a pretty critical aspect of maintaining these systems. Yeah, I mean, and you bring up a point too in talking about kind of the failures, in your own home system. This stuff just changes over time, right? Like material wears out, and you need somebody in there who's going to be aware of what needs to happen, right? I think it's a tremendous benefit to us as a community that we have people whose job is just to think about these aspects of our lives. We get frustrated at times, I think, about the level of oversight that a government has into our daily lives. We like to emphasize our own, personal freedom. And while I understand that, I also recognize the value of these regulatory agencies in ensuring that whatever we're doing is, managing the negative impacts, right? So other kind of aspects of this as well for environmental health. Let's talk about waste. So we have the Department of Health issues permits for solid waste facilities like landfills, transfer stations, recycling centers. We have at least one landfill in Cowlitz County. I think, well, it's the county managed landfill. Funny enough, I'm actually going to go visit next week, so I'm going to get to see it and get a little bit more insight into the management of that aspect. But they're going to approve any solid waste disposal sites and make sure that, again, they're kind of fulfilling necessary regulations. They're going to make sure that if we have a solid waste disposal program, that is in line with guidelines. And then they're also going to react in cases where waste is being dumped inappropriately, right? So they have the kind of oversight at the very beginning of the process, but they're also the body that's responsible for responding when things go wrong. And I think this area is one where people might be more familiar with the Department of Health, is when they come in over top and say, "Hey, you're not doing the right thing in this moment," right? But it is because they need to also be empowered with some agency to deal with people, or to deal with situations rather, where things aren't going according to plan, right? Like, you can't just have an agency whose job is to tell you what the rules are. If that agency cannot also enforce those rules and apply penalties, right? Any law or regulation without a penalty at the end of it is kind of more of a suggestion. you know so they're gonna try to identify those areas where waste is being disposed of improperly, and apply consequences, right? They're not necessarily going to arrest people, but they might charge a fine. They're going to do regular inspections of these places, and ensure that everything's sort of up to code, and then come up with plans to help deal with whatever issues are at the end of that kind of illegal dumping.
Yeah.
They're going to collaborate with external agencies as well, so environmental agencies, potentially law enforcement, to make sure that any aspect of that is not being managed properly is dealt with promptly.
Yeah.
Okay. Yeah, and again, not to keep belaboring this point, right? But the impact of that is, I think, really profound.
Yeah.
You find a situation where somebody is dumping waste into an area that maybe they don't realize is upstream from collection point, and that is actually having a kind of a permeating effect on all of the other areas of the community. It is really important, right, that somebody's kind of paying attention to that sort of thing.
Yeah, 100%. Yeah,
cool.
It's totally true.
Two more things here on environmental health. We talked a little bit already about water wells, right? But if you're going to go dig a well on your property, the Department of Health is probably going to be involved in that to some degree. They are issuing permits. They're monitoring usage of those well systems, making sure that they meet those guidelines. Well water is a big aspect of Cowlitz County. I don't have statistics in front of me for how many people are on well systems versus connected to a municipal water system. But I know that, for example, like 49% of Cowlitz County residents live outside of the 5 major cities. There are a few independent water entities. So, for example, in our area, we have the Beacon Hill Water and Sewer District. But I believe that might be the only one in this area that is not self-managed. I'm not sure how much of the water systems out further east, for example, are directly tied into the county. Probably a good question to go ask. But yeah, so they're gonna like test well water as well, and make sure that there's not like contaminants in there that would be harmful to an individual, and again, kind of help with plans. I'm writing down.
Yeah.
How many residents have wells?
I love that. Yeah.
And the last one, water quality grants. So
Yep.
I know we've talked before about grants, but these are grants that the Department of Health issues. So the Department of Health is also kind of on the lookout for points where they can get community support for improving water quality. So you can apply directly to the Department of Health and say, hey, we want to do something that is going to improve the general water quality of this area. And they have money set aside that they can spend on those things. So, they're going to get your plans and specifications. They're going to provide resources to you, kind of meeting those guidelines. And these are things like upgrading septic systems, removing sources of pollution, restoring degraded watersheds. So dealing with areas where the groundwater is, you know, maybe not being managed perfectly, and you're trying to do some restoration of that. Um, and so, you know, the Department of Health has money set aside that is just for supporting changes to and improvements to the water systems. Um, yeah, it's a pretty interesting and exciting part of uh, the community engagement in Cowlitz County. So, um,
And
any follow ups there, Josh, before we take another quick break?
no, I mean, I think it all makes sense. I know we don't have too much time to go, but I mean, going all the way back up to the top, knowing that we only have a couple
Sure.
minutes, like the fact that meth lab flagging and cleanup is part of that list, right? I mean, is it something that is still plaguing Cowlitz County? Is it a large issue, or is it something that was in the past and we've worked through it and it's now just kind of dealing with the consequences?
We'll talk a little bit more in the current issues section about drugs in Cowlitz County.
Sure.
As far as I understand, the meth problem in Cowlitz County has died down to a
Okay.
degree. It has historically been a problem in this area, but I actually don't know. I don't know how many like meth labs we've identified in this area. That's probably another good question to ask.
Yeah. Yeah, I was just curious.
Sure.
But yeah, no, I know we're right on time here, so I won't belabor the point, but I'm curious to get back to that in the
Cool.
in the current issues for
All
sure.
right, we'll take a break.
Awesome. Thanks, Joe.
All right, and we're back to talk about current issues in Cowlitz County. So, Josh, I've got a list of stuff I wanted to talk through with you. I'm
Yeah.
probably going to play around with the order of things if you're looking at the notes. Um, so, let's start with opioids, because I think that was something we had talked about just before the break, and probably worth just diving into a bit. So,
Yeah.
Cowlitz County historically has had an opioid addiction problem. We have, at least we had a rate, I think the most recent statistics I saw were in 2018, of 12 per 100,000 deaths as a result of opioids,
Mm-hmm.
with a state average of 8. So, statistically, more opioid related deaths than other areas. Um, we have had an average of 13 deaths per year from opioid overdose, um, and half of all drug induced deaths were related to opioid use. Um, the numbers are relatively small in terms of like the broad scope of it, but for an area like ours that is not very population dense compared to other major cities, there is generally speaking a problem with opioid related deaths in this area, and the pandemic has exacerbated that problem to a degree. More people are more isolated, people are feeling more economic stress, and we've had disruptions to the treatment and support channels, right? Which has made it very difficult for a lot of people. We have been working on, and in the last couple of years made some great strides, I think, in dealing with the effects of opioid issues. But
Yeah.
of course, that's a problem that will pretty much never be done, right? I think I remember pretty recently somebody talking about the war on drugs, and it is unfortunately a war that you cannot win. There is no winner in that battle.
Yeah.
Um, we have a few programs that I think are worth talking through.
Yeah.
But this is one that I think comes up most often when you ask people, like, what are the problems here in this area that you expect your government to be dealing with? Drug addiction, and I think more broadly, the uh, the presence of drugs in this area is a pretty constant conversation that folks in the community feel. And like I said, we do have some statistical. Uh, uh, like I said, we do have some numbers that suggest this problem is more severe for us than for other places.
Yeah.
Um, one program that I'll highlight that is doing a lot of work to try to address this, especially with kids. Um, there's two organizations called one called Core Health and one called Community House that I believe are associated to one another, and they try to, as best they can, deal with addiction. Community House just recently, a few months ago, received about $2 million committed to helping them build a new facility that would give kids that are struggling with addiction a place to live, place to stay, and to hopefully deal with their drug addiction issues. We do have uh, a relatively visible population of folks struggling with addiction in our community as well, and Community House provides some recovery resources for them in addition to other like nonprofit efforts in this area. But any questions or thoughts there, Josh, about that issue? I know it's a big one.
Yeah, no, it is a big one. No questions. I mean, I'll share thoughts. I mean, I think it's really great to hear about some of the resources that Community House and those places are getting to build those facilities. As somebody who has had family members with opioid addiction issues, access to resources is everything. Now,
Mm-hmm.
obviously, with addiction, the individual has to come to terms and want to get better. But the saddest thing and the hardest thing is to see those people who want to get better but don't have the resources and can't find those resources. So, While it's a hard, tough subject, it sounds like you folks are trying to make strides in the right direction to help address it and get people to help, which is refreshing.
Yeah, I think so. I think that there are pockets of the community who disagree with the strategy that we've taken to dealing with this issue.
Hmm.
I think that to some degree, the expectation for people in this community is that if you were dealing with drug addiction, you need to figure out ways to deal with it. And I've heard folks in county administration even point to success stories, people who kind of pulled themselves up and out. Frankly, I think one of the aspects that's been highlighted to me a few different times is the challenge with availability of those resources. So one story I'll share was from a guy who his brother was wanting to get clean, and he wanted to go to a recovery facility, but as I'm sure you're aware, the withdrawal symptoms from drug addiction are really, really challenging. And so you need, kind of medical supervision.
Yeah.
There was, if I remember correctly, an 11-day wait from the point where he said, "Hi, I want to get clean," to where there would have been beds available to give him treatment. And so what that literally meant is you need to spend 11 days dealing with withdrawal symptoms before we're going to be able to help you. That is not, by any stretch of the imagination, an easy thing to submit yourself to. And I think that while I understand the fear of enabling people in their addiction and putting money towards programs that will help people get clean, I also recognize that we have to try to find ways to make that decision as easy as possible, right? It's not necessarily the county's fault that there aren't enough beds to be able to give to help people who want that help, right? But I do think it is to some degree our responsibility to try to figure out how to make those resources available. Before we've talked about my approach to addressing problems, I really want to focus on solutions that are led by the community and organized by the community, and to support those, right? And I think that there are areas that are programs that are trying to step up, that are trying to deal with the issue. I want to try to find ways to support them, not necessarily with money. If money is the best way to support them, great. But trying to find ways to help them make those resources available, because that's something that they're trying to do. It's something that they want. This is a really big topic. We're not going to snap our fingers and deal with drug addiction, right? And it's gotten a lot better. I do think that my anecdotal experience is that Cowlitz County does not have as much of a problem as it had even a few years ago. That might not be true by the numbers, but it's certainly how it feels. And I think that's in large part due to the existing work and the ongoing work of trying to deal with this problem and dedicating resources to it. Yeah. So, yeah. Any follow-ups there on the opioid stuff?
No.
Cool.
I think that's extremely well said, Joe.
Great. There's one other kind of side story here that I had put in the notes. Dr. Kirkpatrick. So Kirkpatrick Family Care is a long-standing clinic in this area that provides help and resources to folks. Of course, in a medical sense. He's a doctor. I didn't mean to make that more complicated than it really is. Dr. Kirkpatrick has historically been one of the only places people can go for pain management. Is that my laptop or is that yours, Josh?
That's mine. Sorry, I don't know what's quite happening, but I'm gonna unplug my charger so the beeping stops for us. Give me a second. Go ahead.
Cool. Okay, cool. So, Dr. Kirkpatrick has historically been a place people can go to for pain management. Specifically, they deal with stuff like people with chronic pain, improperly healed injuries, broken bones, things like that. And because of this, there are about 500 patients of his that have some kind of painkiller prescription. Some opioids, I believe opioids are one of the major prescribed medications in this category for Dr. Kirkpatrick. We have had over the last couple of years a lot of changes to our strategy to dealing with opioid addiction, including some law changes that make it harder to get prescriptions. You don't want to just create, and foster like prescription mills of sorts, right?
Yep.
As far as I can tell, this is not the case with Dr. Kirkpatrick. These are just the needs of his patients. But as a result of those changing laws, at least as far as he can tell, prescriptions that he's writing, that his office is writing for people who have had long-standing chronic pain issues are not being filled. And so, like Walmart, Rite Aid, Safeway, they've stopped filling opioid prescriptions specifically from Dr. Kirkpatrick's office. I think because of the volume of stuff that is coming out from his practice. So what does that mean for the patients? Well, they can't get access to painkillers to deal with their chronic issues that they've tried to address but only feel they're capable of addressing at this point. It's just about pain management, right? And multiple patients of his, they did a survey, and they found that 39% of the survey respondents felt that their only other options were illegal substances or suicide. That's the consequence, right, of our behavior towards opioids. In an effort to try to curb that issue, we've put people in a position where the only option they have to deal with their pain is either something illegal or to end their life. And I know that's a really like heavy thing, but I wanted to highlight this particular story because that's a consequence, right, of our kind of prohibitive behavior towards this issue. In a lot of aspects, right, when we make something illegal, we also encourage the illegal propagation of that by way of making it harder for it to be procured through legal means, right? And so, the Department of Health has some influence on this to a degree, but I think it is kind of a pinpoint of a larger problem we have with addiction management, because these folks are going to be negatively impacted by our desire to just fully stop that behavior. I don't know how much credence I would give at this point to the idea of legalization, because I think that's the other kind of counter argument to it is, well, you could just legalize it and then it could be regulated. But I think that is a consequence we need to account for in our honest attempts to deal with this issue. Prohibitive behavior has that kind of fallout, right? And in this case, we have some direct examples of that in our area.
Yeah, that's a really heavy and tough subject, right?
Mm-hmm.
It's and one that obviously has a tremendous amount of opposition from no matter which angle you try and approach it. Right, there will be people that vehemently disagree with that approach, and I think you could say that about almost any type of intervention or work that the government does, but I think more so just because of how bad of a state not only Cowlitz County could be in or is in currently, but the country, right, is with this type of crisis. So
yeah, I'm part of a program that's continuing over the next couple of months called the Citizens Academy. It's a training, like an educational series of sessions on different issues related to law enforcement, law and justice in this area. This last week, we had somebody come and talk from the street crimes enforcement. Street crimes enforcement is mostly about trying to deal with dealers. They do have some aspect of They do play a role in regulating the individual use of drugs, but their focus is mostly on trying to figure out the distribution networks and dealing with the people that are kind of bringing things into the area. One thing that's been highlighted multiple times is the influence of fentanyl as well. How much exposure have you had to fentanyl at this point, Josh? Not
Yeah.
literally.
No, of course, no. No, I know a great deal about it. Unfortunately, my wife worked in the Department of Mental Health
Mhm.
in Boston and was a clinical social worker. So, like a lot of major cities, it's hitting Boston quite hard right now.
Mhm.
So a decent amount of exposure and sad stories that I know about that.
Yeah. Well, in 2020, these are some of the statistics that were thrown out. In 2020, 59% of drug overdoses nationally were the result of fentanyl specifically. Um, this is something that's I think kind of gotten a little bit more media attention lately, but fentanyl is cheap to produce, and it only takes a very small amount in order for you to experience a high, in order for you to overdose, right? Um, some statistics I'll throw out from our area. Um, in 2023, Longview police had 150 calls for overdose. That's not accounting for every other city in Cowlitz County or the county more broadly. That's just inside Longview city limits. Um, the beginning of this year, so in January of this year, we've had 17 instances of overdose. And fentanyl specifically has had a direct impact. I don't have the exact numbers in front of me, but a large portion of opioid related deaths in this area can be attributed to fentanyl. Oh, now that's usually in combination with other drugs, right? People are not usually using fentanyl on its own, but
Yeah.
the street crimes enforcement guy talked about how people will mix fentanyl in with things like cocaine um, as a way of making it more potent. Being able to like sell a little less and it be a little stronger and things like that. Um, this is just something that I think we have to be thinking about and thinking about a lot more urgently than maybe we are at this point. Um, as the substances get easier to produce, cheaper, take up less space, there is a we need some really pointed efforts to deal with that as best we can. And if it's not going to be, prohibition, right? Like drugs are already illegal, then we have to think about ways to at least like curb the effects of those, right? We're not going to, I think, I don't think we're going to remove the problem of drug use and drug overdose, but we can probably control its effects in some meaningful ways.
Yeah.
And yeah.
Yeah, absolutely.
Cool. All right, let's talk about a couple of other issues relevant to the
Yeah.
Department of Health here. So, one that is, I think, kind of rolling around right now is the situation with our county health officers.
Okay.
So, in December of 2021, we had the announced. Is that right? 2021. It might have been later than that. But relatively recently, we had our county health officers announce their resignations. Our county health officers are connected to Clark County and kind of working with Cowlitz County as an extension of the efforts of Clark County. And our Board of Health voted not to renew the county's contract with the Clark County Public Health Department, or with the Clark County Public Health Department. The Board of Health is a secondary group that works with the Department of Health, but has like members of the constituency, and they make a lot of the maybe not executive decisions, but they have some control over the function of the Department of Health. At the beginning of this year, we had no county health officers for our Department of Health because their contracts ran out. We had a job posting up for close to a year for another county health officer, and nobody had taken it on. And so with their contracts running out and them not being renewed by the commissioners and by the Board of Health, we went without a health officer for about a week. Josh, do you have any idea what the impact of not having a health officer is in a county administration?
I could imagine pretty large based on everything that we talked about, the oversight that they have. I could imagine a lot can happen in a
Yeah.
week without any oversight there, but I don't know the direct impact. No.
One of the most timely aspects of not having a health officer is that you can't write birth certificates or death certificates. So think about the impact of not having a death certificate for a loved one that has died. A death certificate is required for most of the services you're going to engage with to deal with that person's death. If you're going to deal with your life insurance, right, you need some record of them having died in order to do that. Funeral homes and funeral services are going to rely on having that slip of paper that says, hey, we have permission now to engage with this. And so without a health officer in Cowlitz County, funeral homes and funeral services were driving to Lewis County and having death certificates issued there, and then coming back to Cowlitz County to help people deal with funeral services. Not having birth certificates is not quite as urgent of an issue, but it does mean that you can't do things that a birth certificate is required for. And that's just kind of one aspect. Without a health officer, there is no authority to enforce food safety regulations. Fortunately, Cowlitz County does not have a big problem with food safety. Again, because our population is relatively small, we don't have a lot of restaurants in this area that would even be subject to those kinds of things. But without a health officer there, essentially you don't have authority to do the really important aspects of being a Department of Health, right? So with that in mind, our county health officer, one of the two, Dr. Steve Krager, was just reappointed, this time as an independent contractor rather than being associated with Clark County. I think the attitude behind not renewing their contracts is worth talking about as well, because they faced some critique. The broad critique of the Board of Health in this instance is that this was a political decision, not necessarily in the best interest of the health of the community, but that they took issue with the way that these county health officers dealt with COVID. They had problems with the attitude of those health officers and I think that there was some suspicion of them being influenced by outside sources to do things that they didn't think were right. Commissioner Mortensen was one of those in opposition to these two having their contracts renewed. And he did make a statement in the most recent renewal or hiring of Dr. Krager that he felt he was confident that Dr. Krager would not be influenced by outside parties. But at any rate, it has been seen as a political decision, the choice not to renew their contracts, rather than in the best interest of the health of the community, it seems anyways.
Yeah. Interesting.
Yeah, it is. You think about like the power that an executive within a county government has, right? Like this is part of their ability to influence is, who's in those seats, right? The Board of Health, a few members of the Board of Health are appointed by county commissioners. Not everybody is, of course, but a few, and that means that you can have something of a block, a group of people that are, pushing for a particular agenda, a particular purpose. This is also the value, by the way, of kind of decentralizing that control. If you were to put it all into the hands of one group, you get maybe something that is not in the best interest of the community. But it's interesting to just think about, right? Like the impact of not having a health officer and then the negative consequences to the community as a result of that kind of decision making, right?
Yeah. No, it really is. It's
cool.
Incredible.
Yeah. All right. There's three more here, so we'll try to breeze through these next through. So the next one is the Medical Freedom Initiative. This is something that was pushed by some members of the Board of Health essentially seeking to limit the health department's authority to implement public health measures like vaccination requirements and mask mandates. Proponents of that resolution argued that individuals should have the rights to make their own medical decisions without government interference, and essentially arguing that the the Department of Health is outside of its jurisdiction to make recommendations and to enforce public health measures. This is a kind of a controversial subject, right?
Yeah.
Because on the one hand, I think it is true to a degree that the Department of Health is not responsible for making you wear a mask, making you get vaccinated.
Sure.
In the same token, I do think it is appropriate for the Department of Health to make those kinds of recommendations and hold businesses accountable for following those guidelines, right? It is not the job of a department to editorialize and to decide which laws they want to enforce and which they don't. This is part of the reason why we have these divisions between legislatures and executives, and so I don't know that I really buy the argument that it's outside of their jurisdiction to be making these recommendations, but I do at the same time see the point that these folks are making. Hey, you have to be conscious of everybody's individual right to make their own decisions. Public health, I think, is a big and controversial topic in the wake of COVID.
Yeah.
And this is one that's kind of reared its head over the course of multiple years. I think this has been going on, this conversation, since like 2021 thereabouts. I think that was the earliest I saw references of it.
Yeah. Yeah, no, I mean, I feel like that conversation is going on in a lot of places, right? But it definitely makes sense. And that's kind of, I mean, that's where my head went, COVID and the mask mandate. That's
Right.
you kind of started to kick that off. So, yeah, no additional thoughts or questions on that front from me.
Cool, yeah. Another that is also, I think, a little bit more directly applicable to the county commissioners is a mental health tax. Okay. So we have a sales tax in Cowlitz County. Yep. It is 1 cent on $10 purchases. So if you paid $100, you would pay 10 cents.
Yep.
And the mental health tax is responsible for funding our county's drug court. There's a drug court in this area. That's just what it's colloquially referred to. But it's essentially an offshoot of the judicial system that deals specifically with issues related to addiction. Yep. The idea, the theory, is that when addiction is involved, you need to deal with crime in a different way. That punitive measures are not as effective when people are struggling with addiction, and the addiction is the motivation for them continuing to commit crime. Yeah. It usually offers recovery resources as an alternative to punishment, and it's been as far as I can tell from what I've read, it's been very successful. Now, look, you can make an argument. You can make any number of arguments using statistics for something like this being effective or not effective. I have not seen a lot of effective arguments against doing programs like this, except maybe that they're not as successful as people would like. But regardless of the individual success of the drug court, the conversation is really about this mental health tax. Do we as a community support the idea that we would pay 1 cent for every $10 spent, and that would go towards programs that help deal with mental health issues, addiction issues, and things like that? The current amount of money that is collected by that tax is about $2.5 million, which is, a sizable sum in a county where the overall budget is like 200 and some million. But it helps to provide funds to, mental health and addiction treatment services in the county. So the reason this is coming up is that just recently, the county commissioners chose not to renew this tax. So it wasn't quite that they chose to get rid of it, but that it was coming up for expiration and they chose not to allow it to continue. And in the election this November, there is an advisory vote being held where people will be able to say, yes, I support this mental health tax, or no, I don't support this mental health tax. Josh, what's your frame of reference for an advisory vote, by the way? Is that worth explaining just a little bit?
Yeah, probably. I mean, I could piece it together, but as always, I like a good Joe
Sure.
definition.
Advisory votes are non-binding polls. So, occasionally, if you want to get, the perspective of a community, and you especially want to get it from people who are going to be voting in an election anyways, we'll put votes onto the ballot that are just kind of trying to collect the general opinion of people. And so in this case, what's going to happen is this mental health tax is going to expire. We will no longer see it after it expires. But the advisory vote is to get the sentiment of the community, whether or not they agree that this is worth continuing on. I do want to kind of point back to the general issue, right? Which is like, if you spend $100, you are contributing 10 cents to this fund. That does add up, of course, but I think that is a very small price to pay personally to see money going towards these programs that are dealing with these issues. And so I generally support the mental health tax. I think that it is a good thing. I don't think it takes too much from citizens. And I think that the benefits of the programs that are currently being supported by that are clear and obvious to me. So, cool. Any follow up there?
No, very well said. I mean, I think it's unfortunate that it's due to expire, because I agree. I think separating drug related crimes and addiction related crimes is incredibly important, and we could talk for 10 hours on the prison system, the jail system, but
sure.
high level, those places are not built to drive sobriety and to help people with addiction, right? Yep. And oftentimes, speaking generally, folks can find same drugs in the prison system or in the county jail system as they can outside. So I think it's incredibly important. So right. I can agree with you more, and hopefully you guys can find a resolution and get it back.
Cool. Yeah, I appreciate that. All right. Last one, a little bit of a divergence from what we've talked about so far, but one that was brought up. Tangents. Last one that is kind of separated from the drug issues, but is a little bit more of an environmental concern. This is something that was brought up recently to me in a meeting that I attended. There is a company called Drax. They're a UK-based organization. They produce wood pellets. They primarily do this from getting, things like sawdust and other like wood scrap from mills. And this company is trying to, or in the process of getting permitted to build a wood pellet manufacturing plant here in Longview. This project in particular has raised some concerns with community members and environmental groups because of the potential impacts on air quality and on, the general public health and well-being, particularly in the neighborhoods that are right next to the proposed facility. Wood pellet production has a lot of, or can create a lot of fine particulate matter. So, you get that into the air, people breathe that in, and it has, kind of negative effects for a long time. And they also produce some volatile organic material and other pollutants that are linked to, among other things, respiratory and cardiovascular health issues. The benefit to the community is jobs, right? Economic opportunities for the region. And that the argument right now is that they have enough measures in place to account for the emissions that would be produced by the facility. And so right now this is in the process of being approved by the Southwest Clean Air Agency. Okay. I believe most recently they got their permit, or maybe that's coming up relatively soon. But at any rate, this is another kind of topical subject. It has some broad implications on infrastructure potentially as well, because as far as I know, the Drax facility is not going to be working with the Port of Longview. Rather, they're going to be trucking things in and out instead of transporting them by boat. So, there's just the potential that this is going to have a negative impact on the overall health and well-being of individuals. And then there's concern as well about trucks coming in and out of our area. How many trucks are you going to need to cart all of that product out? Is that going to have a negative impact on our road infrastructure? Can our system currently support that volume? So this is just one that came up more recently that I thought would be worth talking about as we're talking about public health here.
Yeah, no, I appreciate it. And if you saw me smirking, it was because I'm on Drax's website right now, and it's so funny because the way they talk about their wood pallets and creating it from that leftover mass is that it's a carbon neutral project, and that it drives a lot of sustainability. And then on the other hand, you hear about all this environmental impact and the impact of trucking and in and out. And it's like, at the end of the day, is it really carbon neutral? But that's just my
yeah. To clarify, they are making wood pellets, right? So we're talking about little like nuggets of like sawdust and other things, right? And I do think there is some merit to the idea that we could be doing something with that that wood byproduct. I think here the regulatory agencies are really going to need to step in and try to manage the impact of this. One other aspect that's not really relevant to like the Department of Health, but is to kind of generally quality of life, is that apparently plants like these make a lot of noise. So they said that it was something like a few train horns worth of noise that the factory would produce in the process of manufacturing these pellets. So, I don't know necessarily because I haven't done a ton of research into it on my own. But I think I generally am suspicious of outside companies coming in and taking advantage of the space, taking advantage of these resources. I really want to make sure that we get something out of it and that we're not harmed in the process, right? I know that people don't always give credence to the long tail effect of these environmental hazards, but I think it's worthwhile to consider it. So
absolutely is
cool.
That's why you're the right person for the job, Joe.
Thanks, friend.
But yeah, as we've been talking a lot about, obviously focused this entire time on the Department of Health, I think in the last few minutes here, talk to us a little bit about how the members of your community in Cowlitz County can get involved in public health discussions and kind of bring their opinion and have their voices heard.
Sure. I think point number one, show up to meetings. These meetings take place, in open view, right? And by design, they're supposed to be, something that the general public can engage with. I think that if you're there consistently, you can see the way that those conversations go, and you can start to have some input, in how you might see an effect on your own community. One other piece that came up relatively recently for me is the need for potentially more advisory boards. Looking for people who are interested in having a regular input into the decisions that are being made by these agencies. We may see the need to create more of these advisory boards where we can pull people in and get their opinions. But I think showing up to meetings, getting in touch with the agencies that are responsible for regulating these issues, and frankly, understanding for yourself the impact of these departments is probably the best way to get involved. Ask questions, be curious, right? Because these do have an impact on our lives, even if we don't feel it on a day-to-day basis. And I think it's really important that we all get engaged, get involved in these aspects. So,
yeah, absolutely. I couldn't agree more. I think you might have even just motivated me to take a look at my local government and see
good.
how I can get involved and start going to meetings as well. I think it's something that comes up in almost every single conversation that we've had over the last 9 weeks about again, just the importance of getting involved, and not only just getting involved so your voice can be heard, but to truly understand the complexities of government, even at the local level, and the amount of effort and passion and care that really goes in. Because I think it's very easy to sit in my ivory tower here in my apartment and criticize and be very critical, which, we should be at some extent, but I've never been involved, right? I've never
Sure.
even seen what a meeting has looked like, or how that is done. So
Man, I'll tell you too, there is a sore need for people in our generation and younger to be talking in these meetings. I think that the impression people get is that people within government are just not interested in your opinion. They're going to do whatever they want, and they're not going to take you into account. I would say maybe that's a good argument, except I never see people in our age group and younger at these meetings. Now, I think to some degree there's something that can be done to make these more available. Like the county commissioners meetings, for example, happen on Tuesdays at 9 a.m. When a lot of people are working and busy
yeah,
and doing other things. But,
yeah,
you know, if we're going to make an argument that the government's not listening to us, we have to talk first to say, hey, let's see if they're going to listen to us when we talk. I have yet to find a case where people were disinterested in what I had to say. But what I found is that I was often the only person speaking. And that's really discouraging. It can be disheartening. And I think that's kind of pinpointing the value of us getting involved.
yeah.
Yeah. So cool. Why don't we close out, and then you have a wonderful weekend, Josh.
Yeah, likewise. Thanks.